Hi there, guys. Welcome to the review of PGI January 2017 paper. The May session of the PGI exam is around the corner. I'm sure all of you must be very well prepared for the exam. And so I just thought that since I haven't posted anything in a long while, I thought to give you a very brief review of the January 2017 exam and some ultra important areas that you should not be missing on. So I'll be taking this topic in a subject-wise manner. And the first topic that I'll be taking up is general surgery. The first thing that is important and that should be read by all of you is CA stomach. Apart from CA stomach, you should also be reading about peptic ulcer disease, Menetrier's disease, and gastric antral vascular ectasia. Now, regarding these topics, both about CA stomach and about these conditions, you should be very well versed by all the different manifestations they give, their types, and their diagnosis and management. All these points should be very clear because each of them can appear as a separate option in a question in the PGI exam. Especially concerning with CA stomach, you should be knowing about the risk factors that lead to CA stomach, the different types of staging that is employed, the intestinal type of CA stomach, and the gastrectomy procedures that are done, both as per the curative protocol and the palliative options that are available for CA stomach. So this is one topic that you should be very well versed with. The next thing in line is hepatocellular carcinoma. Hepatocellular carcinoma, you have to along with HCC, you have to know the child pug scoring, you have to know the MELD score, you have to know other conditions that can mimic HCC and that need to be differentiated from HCC, so that is in the diagnosis making part. And you need to know the sections of the liver, the anatomy of the liver, that has also been asked in the previous papers, the segments of the liver. And while we do hepatectomy and we do extended hepatectomy, the segments that are removed in those surgeries, you need to know that. Next in line is the Wilms tumor and its associated syndromes. This is a very common topic, has been asked very frequently, and you should not be missing out on this. The associated syndrome of Wilms tumor and about its diagnosis. Then you need to know about the staging criteria for Wilms, that is the National Wilms Tumor Staging Group, and about its treatment options, and the important characteristics like the age group which is affected most commonly, and how it can mimic other how, like, based on clinical symptoms, how it can be similar to neuroblastoma, and then what are the differentiating features with it. CA breast is an all-time favorite topic. It was here in the January paper as well, and you can expect breast conditions to be there in the upcoming paper. So CA breast, you need to be aware of the risk factors. You need to be knowing the related diseases of BRCA genes. You need to know the staging of CA breast very well. The staging of CA breast should be done by heart. Apart from this, you need to know other tumors of breast such as the phylloids tumor. You need to know about fibroadenoma. You need to know about the surgeries that are done for CA breast, the various mastectomy procedures, and what are the differences between the various procedures. You need to know about breast conservation surgery. Next in line is CA thyroid. All the variants of CA thyroid are very important, especially the medullary and the papillary variants. You need to be well versed with the risk factors of CA thyroid, the surgery and the other treatment options that are employed, their hematogenous and lymphatic metastatic patterns, the association of thyroid with Men's syndromes. Men's syndrome is again a separate topic in itself and is very important, should not be missed. So Men's syndrome you need to cover up. Next in line is CA prostate. CA prostate, you need to know the Gleason scoring very well. In this January paper, there was a question on PSA, and PSA is very important. Standalone PSA can be a standalone topic, and there are some things about PSA which are a must know by all the candidates that will be appearing for the May exam. The values of PSA, the normal values, and in what conditions can you have raised PSA values, the thing called as PSA velocity and why is it important, the fundamentals of bound and free PSA and what exactly is meant by them. How does PSA values change post surgery, post castration? What is known as castration resistant prostate cancer? These are the conditions you should know. There are also certain benign conditions that you should know, like hypospadias, that is not related to prostate but the genitals in particular. Hypospadias and epispadias, these questions have also come in the January paper, likely to be repeated. Testis, the testicular tumors, the classification of seminomatous and non-seminomatous testicular tumors. This topic you should be well versed with, their management and both surgery as well as chemo options, right, related to the lymph nodal stations. This is to be known by you. Next is esophagus. Esophagus is again an all-time favorite topic. Both CA esophagus as well as the benign conditions that are involving esophagus, most commonly the diverticulae and the Shadsky ring and the webs, post-cricoid webs in CA esophagus, and in relation to this, the Patterson-Kelly syndrome. This was also a part of the paper in January. So the Patterson-Kelly syndrome and other conditions related to esophagus, this is particularly important. Then next you have certain emergency conditions like pneumothorax. You need to know the clinical evaluation of pneumothorax and its emergency management. Evaluation of blunt trauma abdomen, frequently repeated topic, you need to know it in and out. What are the emergency management protocols? What are the diagnostic tools available, especially related to fast, extended fast, and the use of CT abdomen? Conditions in which a tube thoracotomy is needed, in what there are specific criteria for the requirement of tube thoracotomy, and the conditions after fulfilling of which the chest tube can be removed. Those you should know. Then recent upcoming topic is sepsis and wound healing. Again, very important. This has come in the past in pediatrics also as part of the guidelines on management of sepsis. So you need to know wound healing, as the stages of wound healing, and especially the strength of the scar that is formed at the various stages. This is important both from pathology and surgical point of view. In pathology, you need to know the exact histological stages in related to the timeline of wound healing, and from surgical point of view, you need to know the strength of the wound and what are the factors that affect wound healing, primary and secondary wound healing. Next is some miscellaneous topics that had come in the previous paper, the various arterial aneurysms. These you need to know, especially related to popliteal artery and the aorta. These are particularly important and you should read them. If you have time, try to read about the femoral artery aneurysms also. The basics are all the same, but there are slight differences concerning with the different arteries. Then intussusception, omphalocele and gastroschisis, these are age-old topics, but this does not mean that we do not need to revise them. They can be forgotten if you have missed them for long. So these are topics that we all know in the back of our mind. So just give them a brush up so that you're well versed with it, and any question is there, you can easily handle it. So last in the line are the topics that are being asked a lot about sutures, absorbable and non-absorbable sutures. You remember them, you mug them up, do it whichever way you like, but you should know the absorbable and non-absorbable sutures by heart. They should be on the tip of your hand. You should not be messing up with these questions, especially in the exam, because they'll cost you both your time and your marks if you do them wrong, right? Next is the dressing procedures as well as some instruments, basic instruments in surgery. You can go through them up. There is a basic list of instruments in at the end of Bailey. So you can just have a look over there. Then there is a topic that is increasingly being asked these days, that is cautery, monopolar cautery, bipolar cautery. In which conditions would you prefer either one of them? And what are the effects and side effects of using cautery versus other instruments? So this is in all a very brief review of the paper, that January 2017 session. And these are the various topics that you should be knowing very well before appearing for this upcoming exam. So if you like this video and you would like me to tackle the other subjects as well, do like and subscribe and share on with your comments, and I'll be coming up with a video subsequently. Thank you.